Well, joining us now is Africa 54 health correspondent Linord Moudou. Welcome back, Linord.
Thank you, Vincent. Well, the World Health Organization just certified Ghana as Guinea worm-free. Guinea worm disease afflicts the world's poorest and most isolated communities and is contracted when people consume Guinea worm-contaminated water. As a result, a meter-long worm slowly emerges from the body through a painful blister in the skin. The neglected tropical disease is being wiped out through health education and behavior change, such as teaching people to filter all drinking water. Today, Guinea worm disease remains endemic in pockets of South Sudan, Mali, Chad, and Ethiopia. There are no vaccines or medicines to prevent or treat the disease. Observers say Ghana's eradication of Guinea worm is a result of hard work, political commitment, and the support of the international community. The World Health Organization says the final stage of experimental Ebola vaccines will start at the end of this month and February in the 3 worst affected West African countries. Phase 3 trials, also known as efficacy or final stage trials, will be conducted in Liberia, Guinea, and Sierra Leone. 2 vaccines, the Chad 3 developed by GlaxoSmithKline and the VS-Visibov from a collaboration between New Link Genetics and Merck, started initial clinical testing on safety and immunogenicity in the autumn. A 3rd one, developed by Johnson & Johnson, has also started first phase trials and should soon be ready to undergo larger tests on efficacy. Dr. Marie-Paul Kieny is Assistant Director General of the World Health Organization.
We know now that the 2 vaccines that have already undergone the first phase of testing, which looks at safety and immunogenicity, so does it induce an immune response, have an acceptable safety profile. So that's really a good news. So it means that these 2 vaccines, which are the most advanced, are continuing their journey towards evaluation. These trials are about to begin for the 2 lead vaccines against the chimp adenovirus developed by GSK and the VSV developed by Merck. And we have already been informed of plans of a 3rd manufacturer, Johnson & Johnson, to also engage into efficacy testing.
And WHO says mass production and mass vaccination could start within the next 6 months if the drugs clear the final stage. A much-needed health facility has just opened in West Africa. The first care center for pregnant women in Ebola-stricken Sierra Leone is now accepting patients. As efforts to fight the deadly Ebola virus continue in Sierra Leone, the country just opened its first care center for pregnant women infected with the disease. The center is run by the medical charity Médecins Sans Frontières. Observers say women are particularly vulnerable to the disease, which is spread through direct contact with infected people and with the corpses of victims.
Pregnant women, we know that they are in higher risk of mortality than the rest of the Ebola patients. So we would like to focus and to try to reach these women as soon as possible, to start treatment and to give them a chance of survival.
Medical authorities say it is unclear why the survival rate for pregnant women is lower than that of other patients. They say early testing and rapid treatment will help lower mortality rates, and the center aims to address that issue. Sierra Leone's first confirmed Ebola case was last May, when a pregnant woman was brought to the public hospital in the eastern town of Kenema from the border district of Kelahon. She died, infecting her nurses.
MSF has been working in this outbreak since the beginning in the different hotspots. Now it's real that it's already 3 months, more or less, and that the outbreak in Freetown is getting stronger. And we consider that the outbreak is still out of control. The cases are still very high. We are in more than 300 cases per week. And all the strategy is still not coping with this outbreak.
The World Health Organization says nearly 21,000 people have been infected with Ebola in Guinea, Sierra Leone, and Liberia since it began in December of 2013. At least 8,000 people have died. Although there are some signs that the transmission is slowing down in the region, health officials caution there is still a long way to go to eradicate the disease. And that's our Africa Health Report for today. Back to you, Vincent.
Well, thanks a lot, Linord. And be sure to watch out for Linord Moudou every Tuesday and Thursday for the latest health news in Africa, right here on Africa 54.